Colon cancer, also known as colorectal cancer, is one of the most common cancers in both men and women over the age of 50. Despite advances in screening and treatment, it remains the second leading cause of cancer-related deaths worldwide. What makes it especially dangerous is its ability to grow silently. In its early stages, colon cancer often causes no symptoms at all. But when signs do appear, they are often subtle and easy to overlook, mistaken for digestive issues, stress, or simple aging. That's why it's critical to recognize these red flags early. Today, we're diving deep into the warning signs of colon cancer that you should never ignore, especially if you're over 50. Your body whispers before it screams. It's time to listen. 1. Blood in the stool. Don't brush it off. One of the most common yet most ignored symptoms is blood in your stool. This can appear as bright red blood, which is usually fresh and indicates bleeding from the lower colon or rectum. It may also appear as dark, tarry stools, which suggests older blood from higher up in the colon. Many people mistakenly attribute this to hemorrhoids, which can also cause rectal bleeding. However, any instance of blood, especially if it's persistent, should be investigated immediately. It's a simple rule: blood doesn't belong there. If you notice it, don't self-diagnose. Don't wait. Your body might be sounding the alarm. 2. Persistent change in bowel habits. Everyone experiences occasional constipation or diarrhea, but a consistent change in your bowel movements, especially if it lasts more than a few weeks, may be a sign of something more serious. Colon cancer can disrupt the function of the digestive system, causing narrowing of the stool pencil-thin shape, chronic constipation, or frequent loose stools. If your regular pattern suddenly changes and doesn't return to normal, don't ignore it. You might notice you're going more frequently, feeling like your bowels never completely empty, or you're straining to go. These changes often sneak in slowly, but they are loud signs internally. 3. Unexplained weight loss. Weight loss can seem like a good thing, especially if you're trying to slim down. But if the weight is falling off without any change in your diet or activity, it's time to be concerned. Cancer cells consume a lot of energy as they multiply, and your immune system ramps up, burning calories to fight them. Additionally, colon cancer may interfere with your ability to absorb nutrients, further accelerating weight loss. If you've lost more than 10 pounds in a few months without trying, it's time for a full health evaluation, especially if it's accompanied by fatigue or digestive discomfort. 4. Fatigue and weakness that doesn't go away. We all get tired from time to time, but cancer-related fatigue is different. It's a constant sense of exhaustion that sleep doesn't fix. Colon cancer can lead to iron deficiency anemia due to chronic blood loss in the stool. This results in low red blood cell counts, making it harder for your body to deliver oxygen to tissues and muscles. You may feel drained, short of breath during simple activities, or even dizzy at times. Don't chalk it up to age. Chronic fatigue with no clear cause should never be ignored, especially when paired with other signs. 5. Cramping, bloating, or abdominal pain. Digestive discomfort is a part of life for many people, but colon cancer often causes persistent cramping, bloating, or a feeling of fullness in the abdomen that doesn't go away. This discomfort may worsen after eating and could feel like gas pain. As the tumor grows, it can partially block the colon, leading to pain and a sense of heaviness. If you've been feeling bloated for days, or you've got abdominal pain that keeps returning with no clear cause, don't write it off. It's your gut's way of asking for help. 6. Feeling like you still have to go even after you just did. This symptom is called tenesmus, and it refers to the sensation of needing to pass stool even though your bowels are empty. It can be caused by tumors in the rectum or lower colon that irritate the bowel lining or block normal function. It feels like a false alarm, but it repeats over and over. Many people describe this as uncomfortable and frustrating, often dismissing it as stress or irregularity. But recurring tenesmus is a red flag you should not ignore. 7. A sudden aversion to eating or loss of appetite. Appetite is closely tied to the body's internal chemistry. Colon cancer can disrupt that balance. Some individuals notice a sharp decline in hunger, nausea after eating, or even feelings of early fullness. This can also contribute to the unexplained weight loss we mentioned earlier. A healthy appetite is often a sign of a well-functioning body. When it disappears without cause, especially if paired with abdominal pain, it may be a sign that something is wrong. 8. Low iron levels or anemia on blood tests. Sometimes there are no visible signs at all, but a routine blood test may show iron deficiency anemia, which could point to chronic internal bleeding from the colon. This is often silent and slow, especially in older adults, and goes unnoticed until blood levels drop significantly. If your doctor finds anemia during routine blood work, especially if you're not menstruating or have no known cause, it warrants a deeper look into your gastrointestinal health. 9. Narrow or ribbon-like stools. As tumors grow within the colon, they may narrow the passage through which stool passes. This results in long, thin, or ribbon-shaped stools. Occasional narrow stools aren't usually a concern, but persistent changes in shape should raise red flags. This sign is often overlooked because people rarely examine the details. But in truth, your stool tells a story. Pay attention to its shape and consistency. It could be an early message from your colon. 10. Family history and age. Even if you have no symptoms at all, being over the age of 50 significantly increases your risk for colon cancer. If you have a family history, especially a first-degree relative like a parent or sibling, your risk may be doubled or even tripled. Some genetic conditions like Lynch syndrome or familial adenomatous polyposis can increase risks at an even younger age. Don't wait for signs to appear. Screening saves lives. A colonoscopy can detect polyps and remove them before they turn into cancer. It's one of the few tools we have to prevent a cancer before it even starts. Final words: prevention is power. Colon cancer is serious, but it's also one of the most preventable and treatable forms of cancer if caught early. The challenge is recognizing the signs your body is trying to give you. Don't ignore persistent changes in digestion, unusual fatigue, unexplained bleeding, or weight loss. Talk to your doctor. Request screenings. If you're 45 or older or have a family history, don't delay a colonoscopy. It's not just about finding cancer. It's about stopping it before it starts. You only get one body, one life. Pay attention to its whispers, so it never has to scream.